Good morning, everybody. This is Monday, the 10th. I hope you had a wonderful weekend, and we're at our COVID meeting. We want to go ahead and get started. Today, we're going to go directly to the board. Typically, on Mondays, we do a little bit more in-depth analysis of the numbers. We're going to follow that routine today as well. Let's go to the board. All right, so we're going to take a look at this slide. This is the number of people tested in the state of Florida. This has a lot of good information. What we want to start with first is look right here in the Tampa area. The bigger the size of the yellow ball, the more testing per capita that is occurring. And so you can see that Tampa is getting an awful lot of testing. A couple of more things that are important in this slide. Look over here at the total number of people who have been tested. It's over 4 million at this point. 536 have been positive and 3,476,000 have tested negative. Now you'll recall that from day one we've been talking about how you break the back of COVID, and that occurs when the number of residents who are negative and well exceed the number of residents who are sick or positive. And so you can see that at this point, that indicator in the far left corner is about 13%. So that means that 87% of the residents are testing negative. So those are really encouraging numbers that we will continue to monitor. Over here in this upper right-hand corner, you can see the percent positive for laboratory testing over the last 6 weeks. It's trending down, and we are just now below the target range, which was set at 10%. That is the same exposure rate that you might see with the flu. And all of this is leading toward the ability for both the state and Regency Oaks to continue to open up the state and go to the next phase. This chart is looking at the number of COVID cases by age demographic, and you can see that the population we serve right over here, the 75 to 84 and the 85 plus, they represent a relatively small portion of the number of total individuals that have been infected. We continue to see the trend of younger adults, 15 to 24 and 25 to 34 as the highest categories of exposure. That tends to make sense, at least in my mind. These are the people who are out and about, they're engaged, their mobility is extended, and so that continues to be the case here. Little change in the median age. This is not the average age, but the median age. So it's the total number of people infected by their age group. And in the state of Florida, it's now at 40. That has slowly been coming down. We'll continue to watch that as well. This is a very broad angle approach. This is showing the number of new cases and where the hot spots are in the state. We always have known about Broward, Miami, West Palm Beach, that East Coast. We've been tracking the other population centers. The newest thing that has changed here is look at the Cape Coral, Fort Myers, Naples area. This has been a more recent increase in that area. You can see that Tampa continues to be a hot zone here in the state, and we'll look at this as we move forward as well. Every Monday we look at these four graphs. This is the graphs that indicate the state's response and our ability to manage COVID cases in our subacute hospital beds in our urgent centers. And the first graph on the left up there in the peach color is emergency room visits with influenza-like illness. So you've seen a pretty steady decline in that. So the number of individuals presenting at hospital is declining. In the yellow, you can see those are documented new cases. In the middle of July, we peaked. It has steadily been declining. So another positive indicator. And to go along with that, look at the ED visits with COVID-like illness as opposed to influenza-like illness. That's seen even a more steady decline since the middle of July. And then the last chart over there in red is the laboratory testing. Again, we've looked at this, but it shows that decline now below the target range. Okay, so that was an overview of the numbers, looking at it across the state. Let's drill down and look a little bit more specifically. Our last report was Friday the 7th. The numbers I'm sharing today are the numbers for Monday morning, so it has 2 days worth of figures. And so it's Saturday and Sunday. In the state of Florida, we are now at 532,000 cases with 8,186 fatalities. It was a little surprising to see the increase over the weekend. On Saturday and Sunday, the number of new cases increased by 22,000, almost 11,500 per day. We had been seeing a decline, and those numbers had dropped from 14,000 a day down to 7,500. We saw that for about 3 days last week, so there was a little bit of a trend. But this weekend, those numbers bounced back up. In Pinellas County, we saw a bit of a bump as well. There were 17,755 cases to date with about 500 fatalities. The number of new cases over the weekend rose by 500, and the number of deaths jumped by 31. Again, deaths are a trailing indicator. We might have expected to see that. We were a little surprised to see the increase in new cases. We will continue to look at these numbers every single day. The number of new cases is what drives some of our critical decision making, and what is looked at. It's one of the criteria in order to move from a different section or from a different phase in our reopening plan. Pasco County was stable. The United States hit a new benchmark. We broke 5 million new cases. The most interesting part of that is not that we reached 5 million cases, but how quickly we climbed from 4 million to 5 million. And here in the United States, we have had 162,000 people who have lost their lives to COVID. We are still in the state of Florida's phase 2 reopening, day 65. And it does not look like the governor has an immediate date on when he might consider opening and moving to phase 3. Testing in Pinellas County is really positive. We did 122,000 over the weekend, hit that number. The infection rate continues to climb. We've seen just a steady day by day increase, 1/10 of a percentage point here, a couple of percentage points the next day. We're at 10.36. So you can see that that infection rate that we're looking for, 10% or less, That's about the same percentage as influenza and flu. We're still a couple of percentage points high for Pinellas County, but we're getting closer, and I anticipate to see a drop in that number down into the 9 range later this week. That's our hope. Here in Pinellas County, we've had 1,702 COVID hospitalizations, and in our specific zip, we saw a pretty significant increase. It is up to 327 folks in the hospital, and that's up nearly 15 for our specific zip code. Let's take a look at what's happening here at Regency Oaks. There's some good news in terms of the number of people in quarantine, our residents. Our IL residents are 18, no one in our assisted living, and 6 individuals in the skilled nursing. That brings the total number of quarantined residents down to 24. That's a drop of 10 since last Friday. That's really good news. Remember, a quarantined resident is someone who has gone to the hospital for a non-COVID procedure and is returned to the community and must go on either a loose or strict quarantine for a period of time to make sure that everyone is safe. With our staff, we are still at 8 staff members under quarantine. There are no new quarantines, and that number is the same as last week. So these 8 individuals, 5 in the skilled nursing, 1 in assisted living, 2 in independent living, will be coming off of their quarantine very end of the week. And with no new cases to report, we anticipate this number will get back to 0 at the start of next week. In terms of COVID-like symptoms or flu-like symptoms that we are tracking, people who are showing symptoms have the 3-day temperature increase that we track or have complaints. There are no residents and no staff in all 3 of our product lines, independent living, assisted, and skilled, that are showing any signs or symptoms of COVID. And more importantly, this is day 6 where we can say that. We've not had any new symptoms present in 6 consecutive days. So at the point we reach day 7, we can apply for additional removal of restrictions. And if this holds Wednesday, we will do exactly that. Our total number of confirmed COVID cases is 3 residents and 15 employees. All of these residents are doing well, as are the associates, and we expect full recovery on the remaining COVID positive residents and associates. All right, so that concludes our look at the COVID numbers. Just a couple of things that I wanted to remind you before we close out, and this is good news. Mary Mackey, our Divisional Operations VP, and Jill Sorensen, the Health Peak Portfolio VP, are on campus today and will be spending 3 or 4 hours with me in my office. That's encouraging because it's the first time that we've had a member of our management team on campus since April. And so just as Regency Oaks is beginning to lift restrictions, Health Peak is doing the same thing for our management team. So although I've spoken and communicate with our divisional support teams several times a day, it will be good to welcome them back to our campus. We're limiting the exposure to residents at this time. We're taking it in baby steps, but it is another indicator that we're getting back to some level of normalcy. Tuesday Talk is tomorrow in the town hall at 10:30. We've been averaging about 50 people. I can take a few more, so if you'd like to come out and have been holding back because you thought maybe the town hall couldn't accommodate safely more than 50 people, we feel pretty confident that we can handle a little bit larger crowd. So if you'd like to come tomorrow, we are setting up for 75 people and think that we can do so safely and maintain proper social distancing. This week, we will also be filming on Thursday for Dish Talk and Menu Chat. Ricky is excited to get in front of the camera and do his presentation, and he's asking for everybody to come out so he'll have a crowd and be able to feed off your positive energy. And then on Friday, we will close out with our forum. So that concludes our remarks for today. Thank you very much for tuning in. I hope to see all of you again at Tuesday Talk. We also will be broadcasting it at its usual time. Have a safe day, and we'll see you tomorrow.